The Nisei Veterans Memorial Center is pleased to present this important conversation on the COVID-19 virus and the current Delta variant surge in Hawaii. Joining us for this conversation is Mike Rembis, CEO of Maui Health Systems, who will help further our understanding of the current surge and all the preventative measures available to us. On behalf of the Nisei Veterans Memorial Center, I'm your host for today, Gavin Kelley. This conversation with Mr. Rembis is made possible in part by the members of the NVMC, as well as the Japanese government. And to our listeners and friends in Japan, 本日はお忙しい中、ご参加くださり誠にありがとうございます。Mr. Rembis, welcome and thank you for joining us today. I wonder if you can talk about the new variant and specifically, can you tell us about its origins?
Well, the new variant, as I think most of us have heard, it came from India. It's a very, very different virus than what we were dealing with before. Far easier to contract. The actual viral count is much higher than before, so it's easier to spread. And the illnesses are affecting a lot of younger people. It's a very dangerous variant. We're seeing now for the first time that someone who's vaccinated, if they have extreme exposure to someone with COVID, could actually acquire the virus. And because they're vaccinated, have very little, if any, symptoms, but they can spread it the same as an unvaccinated individual. So this variant is not only much stronger, but it's affecting people very differently that are vaccinated. And the ability to spread the virus for a vaccinated person who doesn't know that they're positive is very dangerous. So one thing you do not want to do is contract this variant. You'll be very sick, and it's very much easier to contract than the former viruses.
And can you speak a little bit to the severity of this infection compared to the initial?
It is very sad. Today, well, in the past, I would say most of our patients that got very sick were in their 70s, 80s, 90s. Today, for instance, 51% of all of our patients is under 60 years of age. We're seeing very sick patients in their 20s, 30s, and 40s, which we never saw before. And it appears that all of them are the new variant.
And what can people do to stay safe with this new variant, with the Delta variant?
Get vaccinated. I mean, that is the most important thing everyone needs to be aware of. The only real sure way to stop this pandemic and to stop the spread is to get people vaccinated. If you're vaccinated, it's unlikely you're going to get the virus. And if you do, you're not going to be extremely sick if you have any symptoms at all. Everyone has to continue to social distance and wear a mask. Since this is so easy to contract, wearing a mask, whether you're vaccinated or not, is critical. And avoid large groups of people you don't know, especially groups of people you don't know whether they're vaccinated or not. Do not put yourself in that kind of a position right now.
And could I ask you to define what you would define as a large group or large gathering? Like how many people would you start to say?
Well, I think everybody has their own opinion. I believe that the county in the past has identified 10 indoors and 25 outdoors. But my rule of thumb is if I don't know who I'm with, I'm going to social distance and wear a mask regardless of the size of the party. If you're with people you know that are vaccinated and you know what they do, you can make your own decision. For instance, if I'm around people in the hospital that I know is vaccinated and all their families are vaccinated, I might be more comfortable at a meeting with 10 people than I would be at a meeting with 10 people that I do not know. So you have to make a good decision, but in general, it's been 10 indoors and 25 outdoors.
Now, can you talk a little bit about what the hospital is doing right now in the fight against COVID?
Well, we're in the middle of the fight. This is the biggest surge of COVID patients in the hospital we've seen since the beginning of the pandemic. Today, we have 39 positive patients in the hospital. We are treating all the patients, providing the care they needed. We have mandated vaccinations for all of our employees by October 1st. I'm happy to say at Maui Memorial, out of 1,500 employees, we only have about 100 that are not vaccinated, and they're going to be tested twice a week until they are vaccinated. We want to provide a safe environment for you, all of our patients, our residents, and a safe environment for all of our employees. We have all the PPE supplies we need. Most of our staff that are dealing with patients are wearing N95 masks. We have a vaccination clinic open 2 days a week on Mondays and Fridays. We'll open it up 5 days a week if there's a need. We're vaccinating as many people that are willing to be vaccinated as quickly as we can.
How many people in a week are you seeing coming in for vaccinations with the new variant surge?
Not enough. At the peak of vaccination, we were doing 850 people a day. On the 2 days we do vaccination, we were doing only about 100. In the last couple of weeks, it's gone up to a couple hundred. So it has doubled. That is good, but we still know there's a lot of people out there that are not vaccinated. And they can talk to their doctors, talk to the friends that have been vaccinated. It's extraordinarily safe, and it's the appropriate thing to do if you care about your friends, your neighbors, your family, and your community.
Now, changing gears just a little bit, we've actually heard about a lot of scams that are happening right now, particularly targeting our elderly individuals in Hawaii. Can some people pretend to be like a medical institution or calling or emailing elderly for their account information? Can you speak to this at all, to reassure people like who they should be talking to and how not to get scammed?
Don't talk to a stranger about your health care. Do not talk to a stranger about your insurance or your social security number. If you have questions about medical care, talk to your doctor. Call the hospital and let us connect you with someone. If you have questions about insurance, talk to an insurance company, hopefully your insurance company, and get information. If someone's calling you that you don't know, do not answer it. There is no reason, especially during the pandemic, for people to be calling you and asking you about your care, your insurance, whether you've been vaccinated, whether you need to come and see someone that you don't know. And there's no reason ever to give your social security number over the phone to anyone or any financial information to anyone you do not know. Do not allow that to happen. Protect yourself.
I think it's safe to say that hospitals are not cold calling customers on Maui, are they? So if someone's getting a cold call, they should just ignore it.
Ignore it. If a hospital is calling you for something legitimate, they should know your account number. They should know who you are. They should know your address. They should know all that. So if someone calls and says they're from the hospital and starts asking you personal information that you believe they already have, it tells you that's the wrong call to be talking.
No, thank you. And I want to go back to one question I skipped over earlier, because you did essentially address this, but can you speak one more time to the importance about the vaccination in the battle against COVID?
Well, I sure can. The vaccination is a safe way to make sure that you're not going to get extremely sick. You probably won't be hospitalized, and you have an amazing chance of not contracting the virus and dying in a hospital. It is your way to avoid what other patients are now experiencing. A vaccinated individual will seldom be admitted, and the ones we have admitted have been here just for a day or two and have gone home because their symptoms are so mild. And I'm not aware of any vaccinated patient that has passed away. The vaccination will give you protection. It protects you and your family and everyone around you. And all the vaccinations have proved safe, where hundreds of millions of Americans have received it without any significant counter effects. You're not going to have a significant reaction and die from a vaccination, but you may avoid dying if you get vaccinated. It's so important. Whether it's the Pfizer, the Moderna, or the J&J, the Johnson & Johnson, the J&J vaccine has had some rather notable side effects for young women. But when you look at the number of side effects versus the millions of doses distributed, you can make your choice. It's still probably a wise choice to get the J&J if you want only a one-shot vaccine. And if you have questions about possible side effects or reactions, talk to your doctor, talk to a medical professional. They know that if you are potentially exposed to something where you can have a reaction or not, they know your medical history. But the Pfizer and the Moderna have had very little problems. But if you have concerns, again, talk to your family physician, talk to someone who's knowledgeable, and seriously consider getting vaccinated.
Thank you. In closing, is there any area that we haven't covered or haven't gone deep enough on that you would like our viewers to know?
Well, first of all, you need to know the hospital is safe. If you have a medical condition and it's not COVID, you'll be very safe here. Almost all of our workers, as I've shared with you, are vaccinated. We're taking every precaution with PPE. You will be very safe here, and we have beds. We are very full, but we make sure we have beds to take care of the community. We always have beds available for a trauma case, a stroke, a heart attack. We're here for you. It's a safe place. The emergency room is taking care of a lot of patients. And although we focus on COVID so much, I have to share with you, the majority of the patients here don't have COVID. We're taking care of broken hips. We're taking care of elective surgery. We're taking care of people that are having strokes and heart attacks. People are giving birth here. Don't think this is where COVID is. There's far more COVID in the community than there is in the hospital. We have over 200 patients in the hospital today. 39 of them are positive. The vast majority are our community, our friends and our neighbors that are getting great medical care and are very safe. We will do everything to always protect you. That's why we're mandating vaccines here. That's why we're doing everything we're doing. The worst thing you could do is not seek care when you need it because of COVID. During the first surge, many hospitals in the country saw people have a stroke or a heart attack and were afraid to go to the emergency room. Their outcomes were not good. Never stop coming to the emergency room or seeing your physician if you have a serious problem. We are very safe here. We're welcoming. We are very busy. You may have to wait a little bit, but I can assure you we'll take great care of you, regardless of what your medical condition is. We're just being a little bit more challenged during this pandemic. And I have to say, our nursing staff, our hospital employees are doing an amazing job. One of the favors you can do for me, if you see someone that works at Maui Health System, at Lanai, at Kula, or Memorial, thank them. They truly are heroes. I'm in awe every day. You know, they're taking care of patients, many times COVID patients. They could contract the virus. They're protecting themselves, but it's hard work. They're exhausted. Many of them doing double shifts just because the community needs the health care we provide. So thank them. Thank them for what they're doing, not only for you, but for this community. They truly are our heroes right now, and we appreciate them so much. Our physicians too.
Well, thank you so much. And speaking of a busy schedule, we can only imagine how busy your schedule is over there at Maui Health Systems. And we really appreciate you, your staff, all the physicians, the healthcare workers who are on the front line in this battle to keep Maui safe. So thank you very much for your time.
Wear a mask, social distance, and stay safe. Thank you very much.
Thank you, Mr. Rembis.
Bye-bye.
Bye.